So my name is Stephen Muthama. I'm a clinic officer. I'm a reproductive health specialist. Now the problem we have with SHA is the discrimination way of things that they are doing it. Previously, I was able to do pre-authorization for any surgical procedure under reproductive health, that's obstetrics and gynecology, without being limited or without being coerced to use the details, registration details for medical officers or for doctors. But now, SHA is discriminating against me. I'm not able to timely do pre-authorization for surgical procedures for patient, and that takes a lot of time, and that is forcing me to look for somebody else to be able to use their credentials to fill their pre-authorization form. That is the area that we feel SHA is not doing things rightly. If a patient is being discharged today and they are having their SHA forms to be filled so that their bills can be taken care of, I'll do the rest of the work save for the filling of those forms. If a patient needs surgery today and it's an emergency, it is not possible for me to fill those forms because SHA is not allowing me to do that. And yet I did not have such challenges under NHIF. So this delays services to the patient. I am the one who is going to do the procedure to the patient. I'm the one who is going to prepare the patient for whatever procedure because I am trained and licensed by the Clinic of SARS Council. So what SHA is doing is it's forcing me to get somebody who is licensed by KMPDC to use their registration details so that they can approve for that procedure, and also so that they can discharge the patient after they have been treated in hospital or they have been operated. I am trained and licensed by the Clinic of SARS Council, and I should be allowed by SHA to continue practicing under my regulator and not be forced to practice under another person's or a different professional's regulator. The other challenge that we are having is our private clinics, which is over 1,500 in this republic, that are registered and licensed by the Clinic of SARS Council, have been excluded from the list of the facilities that are empaneled under SHA. And the reason for exclusion is simply because these facilities are licensed by the Clinic of SARS Council. So the facilities are now being forced to get their license from the KMPDC. And that is wrong because the owners and the practitioners of these private facilities are not medical officers, they are not doctors, they are clinic officers. Clinic officers are licensed by the Clinic of SARS Council, and they have their private practice licenses issued or offered by the Clinic of SARS Council. And they will continue practicing under the Clinic of SARS Council because that is the regulator that regulates their practice. So forcing them to get a second license from the KMPDC so that SHA can accept to empanel them is forcing them to suffer more financial burden, and it's a sort of discrimination against the Clinic of SARS.